A compound or schizophrenia was formed from the Greek words schism and phren. Schism means to split and phren means mind, so schizophrenia means to split mind. So most of the people can think that schizophrenia means patients of schizophrenia will have split minds, but actually it's not true. It is different from multiple personality disorder. So then what is the difference between that? There is symptom. There are positive and negative symptoms in schizophrenia. And in positive symptoms, there are hallucinations, which is false perception, and delusion, which means false belief, and bizarre behaviors and confused thinking. And negative symptoms include breakdown of thought process and lack of speech, facial expression, attention, and in social interactions.
So I'll talk about the problems. So it is hard to define the symptoms of schizophrenia. It is difficult to diagnose someone as an actual patient. Also, the disease cannot be cured, so it is important to prevent schizophrenia by using programs. So there are six main programs about the schizophrenia. They tend to be low hygienic state, and also they rather face some injuries due to the lack of concentration, and also they often be absent-minded and smiles in inappropriate state. Also, they usually be socially awkward and some kind of hikikomorious. They are really sensitive than others, and that makes them to be kind of insomnia. Lastly, they do some kind of strange or odd behaviors, and all these programs, when you find someone things that you can ask him your schizophrenia, no, not ask him, but just kind of think about him, is he a schizophrenia or not?
And the cause of although the schizophrenia is very common mental illness, its cause is unclear. Many researchers suggest that a combination of numerous factors can result in schizophrenia. As structural abnormalities, some patients have abnormal volume of the brain, and sometimes they have low activity in frontal and temporal lobes. And also the improper regulation of neurotransmitter and the prenatal implication of events can cause the disease. And genetic factor can contribute to schizophrenia too. For example, some patients have less expression of genes which are involved in the regulation of neurotransmitter. And someone whose family has schizophrenia have higher chances of developing the disease. Schizophrenia is caused by viral infection, substance use, and life experience.
So here's the treatment of the schizophrenia. Though drugs are commonly used for treatment of schizophrenia, it is not effective as treating the negative symptoms of schizophrenia than positive one. And it is important to consider the side effects and efficacy of the drug when you choose it. Also, therapists use individual or family psychotherapy, including cognitive or behavioral therapy, as well as specialized educational programs and self-help and supportive groups. Although the treatment of schizophrenia is complex, we have to use combination of therapy. So finally, why do we have to study schizophrenia? Roughly one of 100 people in the world have schizophrenia, and if we include the people with mild schizophrenia, the number increased to 1 of 10. So schizophrenia is a very common mental illness, but people have afraid of being labeled as crazy, so they don't seek for any help, even though they notice that they have some problems. It causes the difficulty in diagnosis of the schizophrenia, since the diagnosis of schizophrenia mostly depends on interview with the patient. So, in conclusion, by researching and studies, we have to develop the method of diagnosing that not depends only on the patient's work, but physical condition of the patient. Thank you for listening. In Korean, 감사합니다.